Good morning and welcome to the San Francisco Interfaith Council online briefing for community and faith partners. Today's program addresses COVID-19 vaccine equity and MPOX. A special thanks. Today's online briefing is made possible by a grant of the Center at the Sierra Health Foundation's Vaccine Equity Campaign. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the presenter and answered time permitting. To activate closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. There's no time like the present for San Franciscans to prepare for changes in the virus by taking basic actions that can protect them, their families, and their community. The San Francisco Department of Public Health urges people to be ready for COVID by staying up to date on their vaccinations, knowing how to reach their doctor, keeping a supply of rapid COVID tests, keeping masks handy, planning ahead for a possible infection, and staying informed with trusted sources of information such as sf.gov/COVID. The San Francisco Department of Public Health recommends the following for keeping congregations safe during COVID. Continue to gather. Keep in mind your congregation's demographics. Encourage vaccines and boosters. Wear masks indoors. Reinforce the stay at home if sick message. Provide testing resources and share be COVID ready messaging found at sf.gov/b-covid-ready. For more information, call 628-652-2700. The COVID vaccines are safe, effective, and open to everyone 6 months and older. Boosters to everyone 5 months and older, and the updated booster to everyone 12 years and older. MPOX vaccines and boosters are now available to those exposed and to certain eligible groups. Go to sf.gov for more information on vaccines. Now is the time to come together, San Francisco. Together, we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, call the SFPD at 415-553-1133. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Director Michael Pappas. Michael, the floor is yours.
Thank you so very much, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for community and faith partners. With the fall season upon us, concerns in the media alert us to a possible spike in COVID-19 test positive cases. Additional concerns continue to be raised with respect to vaccine equity, especially among BIPOC, Black, Indigenous, people of color, and other vulnerable populations. To complicate matters further, our city has been called to respond aggressively to the outbreak and spread of monkeypox. This week's online briefing for community and faith partners, hosted by the San Francisco Interfaith Council, welcomes San Francisco Health Officer, Dr. Susan Phillip, and Oscar Macias, who will report on the city's strategy to address these timely and critical issues. The role communities of faith can play in partnering to mitigate the spread of these viruses and ensure equitable access to vaccines, as well as respond to questions posed by faith leaders on these and other germane issues. At this time, it is my great pleasure and privilege to welcome San San Francisco Interfaith Council board member, a assistant professional researcher at UCSF Department of Family and Community Medicine, associate pastor at Third Baptist Church, and executive director of the San Francisco African American Faith-Based Coalition, Reverend Dr. Jonathan Butler, who will ground us today with a meditation, but as well will read the opening SFIC statement. Dr. Butler, it's great to have you with us.
Thank you, Mr. Pappas. It's certainly a privilege to be able to join you all again, and I'm so grateful for this opportunity. Here's our interfaith statement. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. That is our interfaith statement. As a reflective moment, I've had many opportunities this week to really reflect on the scripture of Isaiah, first chapter, 17th verse, when it instructs us to learn to do good, seek justice, rescue the oppressed, defend the orphan, and plead for the widow. When certain groups are treated unfairly, it really insults our God, but it honors God when we plead their cause. Now, there's a lot that is going on in the city of San Francisco these past weeks, these past months, in terms of a lot of violence and crimes. And I'm reminded of this book that I read when I was a PhD in my sociology class called Democracy in America by Alex de Tocqueville. He's a Frenchman who visited the United States in the 1830s and wrote a book and admired, in this book he wrote, he admired the United States and he predicted great things for this nation. But de Tocqueville also concluded that the individualism that exists in this American culture has a darker side. He feared that radical individualism would lead to a breakdown of civic cooperation in America, and each man or woman is forever thrown back on him or herself alone, and there is danger that that person may be shut up in the solitude of their own heart. He concluded that American individualism has become cancerous in the unbridled pursuit of self-interest. Self-driven Americans forget that personal welfare depends on the general welfare. And institutions like family, religion, civic participation can help moderate our individualism, yet these spheres are themselves teemed with individualism. So for example, if you invest in your family, sometimes that investment can serve as an excuse for not participating in the wider community. As Tocqueville observed, that each citizen isolates himself from the mass of his fellows and withdraws in the circle of family and friends. Even religion in America has become very increasingly sectarian and individualistic. And even certain participation may be rooted in a variety of motives, especially in our civic sphere. And some who are active in public affairs are sometimes moved by just this genuine concern of the local community, while others are involved in order to look out for their own interests. And so many political actions originate in gatherings of like-minded individuals whose cooperation depends primarily on their common economic interests. And what does this have to do with health disparities? Because a lot of times when we think about health disparities, these are inequities in health. Often it means earlier death and increased mobility for one group of people versus another. And so regardless of one's health indicator, though, being examined, whether it's COVID, whether it's weight, whether it's diabetes, whether it's HIV and AIDS or obesity, inequities in health usually point to inequities in income and education. And I think one of the challenges that we have to reflect on is that we began to think about our own selves without the understanding of who we are as a community. And that's one of the challenges that we face, and has led to some of these inequities that we experience. So it's not enough to find out what's wrong with the community and try to fix it. But we need to go deeper in understanding of, who we are as a community of people, who those that are on the margins, who they really are. Going deep into, what are their needs, and have to shy away from our individualistic, perspective, only thinking about, what I can do for myself, what I can do for my department, what I can do for my city, but thinking about collectively, what can we do as a whole? And so I think when we address inequities, as Dr. Phillip will be addressing, inequities in a COVID vaccine and monkeypox, we as faith leaders have to think of it as a moral issue, and that we have to get out of our silos, coming together to address this and understanding who we are as a community. I think that's one of the ways in which we can move out of this state that we're in as a city, as a country, as a nation. And I think that if we want to learn to do good, seek justice, and rescue the oppressed, defend the orphan, and plead for the widow, we have to understand, really go deeper into who they actually are. So thank you.
Bless you, Dr. Butler. I'm going to have to brush off the dust on my Alex de Tocqueville and reread, because I think that was an important reference and a wonderful segue into today's programming. Dr. Susan Phillip is no stranger to our community of communities of faith here in San Francisco, and we are thrilled that she is back with us today. She's from, I mentioned to her in the waiting room that these programs would not be possible without the impetus that was given to us at the outset of the pandemic by the Department of Public Health. And so we are very grateful to Dr. Phillip, as well as those at the Department of Public Health, for really giving birth to these programs. This is the 86th program that we have produced since the outset of the pandemic. We are also mindful of the fact that the pandemic revealed inequities, many inequities, both in public health, but also economic, education, and other aspects of life in San Francisco. Today, we are very grateful to focus on vaccine equity, especially in the BIPOC and other vulnerable communities. We received a very generous grant from the Sierra Health Foundation to be able to help the California Department of Public Health in its outreach, and so today is part of that. And so, Dr. Phillip, we thank you for being with us. We thank Oscar Macias, your liaison for the Department of Public Health, and we invite you at this point to take the stage and enlighten us, after which we will pose some questions from some of our faith leaders that have been submitted in advance.
Well, thank you so much, Director Pappas, and it's such a privilege to be here with you all again. I really enjoy being able to gather with you, to share with you, and to hear from you as well. And I hope to be joined today by my colleague, Oscar Macias, who's been a real leader in our vaccine equity work, both for COVID and for Mpox. And as many of you know, when you're a very busy frontline individual working directly with communities, sometimes things come up and urgent issues come up. So I'm hopeful that Oscar will be able to join us, but if he is not, then I will share what I can from my perspective. So I also want to recognize, again, it's so wonderful that you all were recognized for the important role that you play in community updating and information around COVID-19. And so it's wonderful that you all have received the grant with that recognition of the critical role that you play. It also is wonderful to be on the program with Dr. Butler, who has been such an instrumental agent for equity during COVID-19 and beyond, and agree with Director Pappas that those were very inspirational words and something that we can hope to achieve in public health. And I know as faith communities and faith leaders, you are also focused on this idea of interconnectedness, support, and community, building towards a more perfect, beloved community. Next slide, please. So I will not spend a lot of time going through the numbers piece by piece, because I really am hoping to spend more time on the equity components and on the community work with COVID and with MPOX. But I just want to say, and we will share the slides afterwards, so people will have all of the information to be able to look at that in the details. But I really just want to say that both from the perspective, Oscar is able to join. Good morning, Oscar. So glad to see you. That we're doing well as a city, and that's good. The COVID numbers are really improving and have come down. So here on the left is the graph of our 7-day rolling average, and we're down to 44 on average cases per day. We do know, and it is important to state, that this is an undercount. It is definitely an undercount because this does not capture home-based testing that is not reported. This is really strictly based on laboratory tests. But the trends are important, and the trends have held over time. And when we look at wastewater surveillance, which is another way in which we can get a sense of, as a city or as a state, where trends are heading, that is also trending down. So almost certainly we are seeing a decline and a lull in the amount of COVID that's in our community, but COVID is still with us, and that's still important to understand. Along with our cases going down, we're so happy that hospitalizations have also declined, and we know that overall our percentage of people vaccinated in San Francisco remains quite high, even as we're entering into the period now and the era of these updated boosters, which I'll talk about in a moment. So we are in a very good place as a city, and as a Department of Public Health, we are really now focused on making sure, as Dr. Butler said, that all of our communities have equal access to protection against COVID-19 and MPOX where it's available and where it's appropriate for them to have that. And that we are thinking about equity and doing that equity work, which is intensive. It takes a lot of work and a lot of ingenuity and a lot of partnership with community in order to do that work. So again, Oscar, my colleague who's here, is really one of our top experts in doing that work. And so we'll hear from him in just a moment. Next slide, please. So again, our vaccination rates are very high, and compared to other places, they remain very high among people of color as well. As a result, we have less severe disease, but we are seeing some disparities in our booster rates by race and ethnicity. And increasingly, I think what we're understanding is that at least under the current types of vaccines that we have, one dose or 2 doses and a complete initial series does not confer long-term immunity. And to some extent, boosters do seem as if they're going to be necessary, hopefully just on an annual basis, like we do with the flu. But hopefully and potentially there might be newer models of vaccines coming out later down the line that may even have more durable immunity. But the vaccines work incredibly well at keeping people from becoming very, very sick. And so they remain a really important tool, probably the most important tool that we have. So in terms of people who've gotten at least one booster, 64% of our overall residents, 17% have gotten a second booster. And remember, the second boosters are really for people who are 50 and older, who have underlying health conditions. So not everyone is eligible for that second booster of the prior vaccine. This is looking at the older formulations, not the new one. We'll talk about that, and that's coming forward. And then we have residents who have completed their primary series, 85%. And when we look at the bottom right, when we look at it broken up by race ethnicity, we see that we still do have work to do to make sure that Black African-American residents have opportunities and have low barrier ways in which they can get vaccinated, and that we continue to talk about the newer formulations of boosters with all of these groups as well. So this is looking at the complete vaccine series, the primary series by race and ethnicity. And as I said, we're doing well compared to some other areas of the state and the country, but we still want to continue to improve from where we are, and again, to make sure that all of our residents have access to good health in the form of vaccines. Next slide, please. So, overall, as I said, the case rates continue to decline. Our hospitalization rates are low compared to where we were during the heights of some of our surges. Holidays are coming up and we want people to be prepared and have the best protection that they can. The virus has changed over time since it was first introduced, and now we have much more transmissible variants. The BA.5 subvariant of the Omicron variant of COVID-19 is highly transmissible. The vaccines, again, do protect against severe disease and hospitalization, but not necessarily against transmission. So there are these new bivalent boosters that people, I'm sure, have heard about. This is the first time since the vaccines were initially introduced that there's been a change in the formulation of the vaccines, and they've been designed to really be effective against these new subvariants that we've been talking about, BA.5 and BA.4. And they are now available. So the original monovalent vaccines that we've been talking about in the data and statistics I just showed you, they're still safe and effective, and the bivalent vaccines are approved for people aged 12 and up as well. But the primary vaccines, the new bivalent vaccine formulas are not for people completing an initial series. They are really only meant for boosters for 12 and up. And so for people who are younger than 12 or people who haven't completed their initial series of vaccines, then they go back to the original formulas for that purpose. Next slide, please. And then just to talk a little bit more about the bivalent boosters, they're being rolled out now, and they are available at health systems and pharmacies and some of our San Francisco Department of Public Health clinic sites. And people who have insurance should reach out to where they get their usual care. And many of those health systems, as I have said, Kaiser, UCSF, Sutter, they all have access to vaccines and ability to vaccinate their patients. And the new bivalent boosters are recommended for anyone 12 and up. If your most recent vaccine was at least 2 months ago, 2 months earlier, you do have to have a 2-month space between your last vaccine and this updated booster. Children, can also be eligible for a booster dose, but they will have to receive the original booster. And there aren't any boosters that are yet authorized for very young children, but primary vaccines are available for that youngest age group now. And we do encourage, families to consider that and to speak with their child's pediatrician or care provider if they have additional questions. So currently nationwide, there is a shortage just based on some issues with FDA authorizing certain factories and authorizing certain products to go out of the Moderna bivalent boosters. So there are 2 formulations that are available, both the Pfizer BioNTech version and the Moderna version are now authorized. But Moderna is in more limited supply. So we're telling people, get whatever brand is available to you. It's more important that they're bivalent and that they're available. So if it's been 2 months since your last vaccine, then it's a good idea to get the bivalent booster. And if Pfizer is what's more readily available, it's absolutely fine. It's a good idea to go ahead and get that as well. Next slide, please. So now I'm going to turn to talking a little bit about Mpox. And we'll give a brief overview there, and then I'll turn it over to Oscar to talk about our equity efforts with vaccine, both for COVID and for Mpox. Next slide, please. And I think I had briefly talked about Mpox the last time I was here. It was really sort of just coming onto the horizon. It hadn't yet really taken off as the global outbreak that it has become. It is also a viral infection, and it spreads very differently, though, than COVID-19. It's a different type of virus. It is spread person to person by very close contact, skin to skin contact. This current outbreak is primarily spreading through sexual contact, and it was introduced initially in Europe from where it had been endemic in certain parts of Africa into populations and into social networks of gay men, men who have sex with men, bisexual men, and transgender individuals. And those remain the populations that are most at risk worldwide and also in San Francisco. So we are now referring to what was previously called monkeypox as MPX as the abbreviation, and we're terming it MPOX. And the reason for this is really to try and combat stigma. The name monkeypox is a misnomer. This has nothing to do with monkeys. It is not found in nature in monkeys. It is not transmitted to people from monkeys. And it was really a stigmatizing name. So the World Health Organization is in the process of rethinking the name and getting input into a new name. But in the meantime, the California Department of Public Health has really decided to use this term MPOX, MPX, and we at SFDPH are doing the same. We want to avoid stigmatizing people or groups when discussing this virus. And like any infectious disease, MPOX can occur anywhere in the world and can impact anyone. We do know that there are the groups that I mentioned that are most being impacted, and that is where a lot of our equity work is happening. So the name change really reflects our values and we're following the California Department of Public Health in doing that. Next slide, please. So in San Francisco, we have had 787 cases as of the 18th of this month. This is a curve that shows the number of cases by date. And again, as with COVID, there's good news here, which is that due to the efforts of the community and our partnership as a department and with many other health system partners and community organizations to lead the efforts in San Francisco against MPOX, and the support of so many of our elected officials and leadership in San Francisco to advocate for vaccines, which are the staple, again, in decreasing the number of cases in San Francisco, we are on the downside, it appears, of this curve. And what we have seen again is that we have declared a public health emergency for MPOX at the end of July and have been working ever since then in an emergency activation structure for MPOX while we are still dealing with COVID, while we are also focusing as a department on making sure that the Laguna Honda Hospital is certified and available for the needs of our residents and families who are using it and need it in San Francisco. So multiple very important issues happening in San Francisco around health that we've been involved in. But the cases are coming down, and this is because of vaccine and people's willingness to get vaccine and all of our partnerships in getting vaccine out to community. And we, again, still have work to do, which we'll hear about from Oscar, but also people's understanding of how MPOX is spread and making decisions to protect themselves and others to reduce their own risk of MPOX and the risk of transmitting within the community. So much credit has to go to communities of gay men, bisexual men, men who have sex with men, transgender individuals in San Francisco for really bringing down these numbers. Again, MPOX infections are not right now spreading through the general population. It is not a general risk in our schools or in other settings, but we are thinking about all of those aspects and partnering with leaders in those areas to make sure that people have information and that we are prepared to answer questions and provide support. Next slide, please. I'm going to show you a little bit of the demographics. I spoke to this just a bit, but the vast majority, and again, we'll share these slides, so I don't necessarily want you to have to follow along super closely. I will just give you the main trends as we're seeing it. The vast majority, about 70% of cases are in the ages between 25 and 54. And we're seeing that about 96% are people who are men, and then a smaller percentages within other gender identity groups. Next slide, please. For sexual orientation, people who identify as gay, lesbian, or same gender loving are 70% approximately of 69% of the cases. And but it's important also to note that for almost 24%, we don't have that information. People either decline that information or they're not known. And among the cases, we are also seeing a marked disparity, and this is reminiscent of COVID, where certain groups are disproportionately impacted. So the most striking one here for MPOX is people who identify as Hispanic or Latinx They represent 15% approximately of our population, but they've been about 28% of the total cases. So a lot of our equity work around vaccine and around getting information out is really building on those partnerships that have been established and strengthened with the COVID-19 response, and bringing this new information about this new outbreak of Mpox. Mpox, the other distinguishing thing between this and COVID-19, which of course is spread through respiratory route for COVID-19, is that Mpox is not a brand new virus. So in 2019 and 2020, when COVID-19 came on the scene, this was the first time that humans had been exposed to this virus. Mpox has been around. It was identified in the late 1950s, and there have been various outbreaks here and there since then. So it is a virus that we knew about. It's related to smallpox, but luckily does not cause a severe disease. And so there were vaccines that were available against it. And the current vaccine that we use is called Jynneos. And so that is what we've been working to get out to the public. Next slide, please. So people who are eligible currently for the vaccine in San Francisco, and this is pretty consistent across the Bay Area, gay or bisexual men, or any man or trans person who has sex with men or trans people. Again, this is because these are the networks in which we are seeing infections currently. And then anyone of any age, any gender who's had close contact with someone who has suspected or confirmed Mpox. People who've been at a venue where there's been a suspected or confirmed Mpox case. And then people who do sex work, any gender any gender identity or sexual orientation of those individuals. And then clinicians or laboratory workers are also people who are being prioritized for a vaccine. If they've had a high risk exposure, and laboratory individuals who are working with the virus and with testing viral samples. Next slide, please. Temporarily, because we have large events coming up, the Folsom Street Fair and the Castro Street Fair, which not only draw San Francisco residents and Bay Area residents, but people from throughout the country and the world. We've expanded our ability to provide the Jynneos vaccine against monkeypox to eligible people who are visiting San Francisco as well. And it will last through the end of the Castro Street Fair on October 2nd. We have been able to apply for and receive an additional 10,000 doses of Jynneos vaccine from the federal government to actually do this, to provide this protection to people in San Francisco and people who are visiting as well for these very large, well-attended events. And we're implementing community strategies to reach people who are inequitably impacted by Mpox, especially BIPOC and Latinx communities. And you'll hear about that in just a moment. Next slide, please. So for resources and where people are able to go to get vaccine, many health systems are providing vaccines to their patients and the general public. In particular, Kaiser and UCSF have phone resources that are available for people who are not their patients, not their members, but they're doing this as a service to the larger community as well. And then through people's own health systems, they are likely to be able to get vaccine as well. And then drop-in vaccine for San Francisco residents who meet eligibility requirements are available at the San Francisco General Hospital campus, Building 30. And you'll see all the numbers and the ways to reach the vaccine information and vaccine access through the information here as well. So again, this will all be coming to you. Next slide, please. All right, well, it is such a pleasure. I'm glad I got my part out of the way, and I'm going to be around to answer questions, but I really want to turn my work over to my colleague, Oscar Macias, who's been such a leader in our work around vaccine equity for COVID-19. And because of his expertise and because of the disparities we were seeing, I immediately knew that he had to be part of our answer to assist and partner with community around Mpox as well. And he has in his background a great deal of expertise in HIV prevention, sexual health, and working with communities. So he's the ideal person. So I'm so honored and thrilled to introduce Oscar and to have him take over for the last part of the presentation. Thank you, Oscar.
No, thank you so much, Susan. And my humble apologies for being late for this meeting this morning. What is usually a simple commute from home to the office turned out to be a little bit of a nightmare. But I'm just glad to be here and have the opportunity to shared some of the work that I've been doing for the last 3 years with this wonderful group of people. I've noticed see some really good familiar faces, and just warms my heart. Next slide, please. So when we talked about COVID response, I mean, this, and before we touched into these bullets, I just would like to, get a little bit of the landscape of what, how we got to these measures today, right? So when COVID first started, I mean, it was, it hit certain communities, right, that were already experiencing a specific health disparities. Social determinants of health were affecting their way of life. So when these conditions, when COVID came, these conditions made them more vulnerable to the crisis that was brought by the COVID pandemic. Again, you know, it was the populations that were most affected with people of color. At one point in the epidemic, at the highest of the COVID pandemic, 51% of the cases were among Latinos, and not just only Latinos, but Spanish-speaking monolingual Spanish-speaking Latinos, or Latinos that did not speak Spanish. You know, for example, they spoke a dialect. So we really. By the time the shelter-in-place mandate came, I mean, community was really nervous and didn't know what was happening. As a health department, you know, our job was to take care of the people. We had been in planning and within, you know, we had created COVID Command Center. We had a plan to move forward. However, what we realized is that for us to be the most effective is that we needed to partner with community. Right? Community had been at the forefront of the pandemic since the very beginning. They were the community-based organizations, you know, the parishes, the churches, the health centers, the neighborhood health centers that were at the forefront of the pandemic, and they were there to first hear and respond, you know, to the needs of the people that were coming and turning out positive for COVID. So we immediately knew that in order for us to be effective, we needed to partner with community, and instead of coming from top down, just approach this effort from a place of humility, and you know, just carry forward and elevate the work that has been done by our community partners. This effort, you know, took a lot of investment time. You know, it took a lot of planning of meetings. It brought us together, and it made us really be able to have those difficult conversations, right? And be respectful of each other, but also owning accountability, right? It was not about being right or wrong. It was about what was the best way to get the work done, and what was the best way to take care of our communities. And most importantly, is that we involve decision makers within the community, right? So when mobilizing this model, this new co-leadership model, you know, I think it was one of the first times that the true partnership came from the health department and community. We became, you know, equal partners in this process. We started working in the efforts shaped by community, you know, sharing the same values, sharing the same guiding principles, and creating a space, a safe space for our people to thrive in the midst of a pandemic. And most importantly, it was just delivering those services with a culturally component effort. It was not just bringing people to communities to provide a service, but, you know, it was bringing people that, number one, spoke the language, and number two, they look like us. You know, we looked alike. We understand where we came from. that connection could have been made, right? So with that said, I mean, like testing programs were implemented and developed in the mission, in the Bayview. We brought providers that were able to connect with the organizations and the community. We elevated the staff from the CBOs to be able to be part of this effort, because we knew that it was through them that we could get people to come to us to get tested and possibly find out, they were positive for a disease that at the beginning did not have a vaccine or treatment. So, finding the best ways to work with that. With that said, as a health department, we saw that we had an incredible asset within our people who were trained to do HIV prevention counseling. So we activated all of those people that were working at specific CBOs, providing HIV prevention services, to come into community, train them, and create a force that was able not only to engage with community, but provide health information and deliver for some of them difficult news about their health, right? So a culturally appropriate case investigation and contact tracing team was created from those partnership with our CBOs, right? So connections were made through the phone, in person, and at every level, just to provide that level of care that people needed at the moment, testing, and then afterwards. Right? That is so important. When it came time again, when it came time for vaccines, we the health department developed these massive places, the Moscone centers, the city colleges, the Kaisers, that were providing were used as mass vaccine sites. But then, how do we bring people to these places? What were the strategies? How would we tell them that they're going to be taken care of here? And part of my job, I've been working with the health department for 22 years now, and one thing that I've learned about my job is that it's 95%. My job is about 95%. The relationships with my programs and relationships with anybody who you come around, right? So I never really understood the power of that until I started picking up the phone and asking for help, right? I ask, of course, our usual contacts through our HIV prevention funded programs to tell you people they can come here to get vaccinated. I went to the healthcare system, right, and through my contacts over there, and created this underground network of providers that reached out to community and said, hey, we have this service for you that you need, and this is what we're gonna do to make it comfortable for you to come here. So we talk to, again, having conversations with our community leaders, like how are we gonna get them? How are we gonna get back? How are we going to? What are we gonna do? What systems are going to be in place that will make this our people feel comfortable? So, we managed to get vouchers for people to come in and back home to their vaccine appointments. We managed again, to make sure that they saw represented in the staff. We provided language capacity for translation, and we guided those people. We saw their need, we saw their fear, and we intervened at a level with people that represented them and made them feel comfortable.
Oscar,
Yep.
I think let's we will give out. I don't think you need to
Yeah.
walk through the slides. So
Okay.
we'll send people the rest of the slides.
Yeah.
I think what you're sharing is really really important. I think you will also, you might agree with this, that this is not an easy process, particularly not easy for the health department, right? We had to learn to operate in a different way.
Yeah.
But your
So,
leadership and others, it's been transformative.
Yeah.
Move forward.
Yeah. No, and I'm sorry. I should have said that, because as I was thinking how to present this last night, it was obvious that, I mean, the slides speak for themselves, right? I really just want to tell the story, because it is relevant. I mean, to me, I mean, it was the importance of the health department to be humble and partner with community. The importance to bring the leaders of the community to tell us and inform us what they wanted us to do and how to move forward. I mean, that is what created the equity piece for the work that we did. And that model follows our response to monkeypox, mpox. I'm sorry. We already had developed through COVID. You know, we already had developed the systems and the systems to deliver testing and care to specific populations at a specific neighborhoods to a specific people, right? So building on those efforts and building on our experience working with our with HIV and STI prevention, you know, we were able to you know, broaden that net and start developing, you know, the interventions that we have now, which for monkeypox, it is to maintain community informed. So we have community huddles every Friday, both in English and in Spanish, for community to in where we you know, give up the most current information to our to community, both in English and in Spanish. We also have a newsletter that we are distributing among our providers, right? That again contains the most up-to-date information and the most up-to-date data around COVID. And if you're interested, I mean, there is a slide forward that has the link for that newsletter right here, right? Again, you know, it was important to, we had a place for people to get vaccinated, but then again, how do we get people to get, how do we bring people to San Francisco General for them, you know, to have their vaccine, when the media was portraying San Francisco General, this place that we waited for hours and hours and hours for you to maybe not get a vaccine, right? So how can we bring that the notion away and make people come? So we had this conversation with San Francisco General, and what we were able to do was what we created spaces, specific times that were allotted to us. So priority appointments would be made for people at the highest risk, right? And for this, we were focusing on Latinos, Black African Americans, and Indigenous populations, right? So again, building on the system of referral that we had through COVID, and then our HIV prevention services, we were able to do a mass blow out the message within community and say, you know, you contact us, give us a chance, and we will give you the opportunity to go to San Francisco General, so you don't have to wait in line, and that your dose is going to be guaranteed. Because that was the fear. Why would I go to a place if I'm not going to get it? You know, if I'm not going to get it. So we broke that down for our communities, and we made sure that they were taken care of.
And
Uh,
I think that was one way, and there've been so
Yeah.
many ways in which
Yeah.
you've listened to community and then, helped inform what should happen. And so it's been incredibly important to be able to do that.
And that leads to our community, most current community strategy, which is pop-up events, right? So those are not your brick and mortar place where you go to get a vaccine, but community members will come to us and ask us, can you bring vaccine to my population because they are the highest risk? So we say, of course, right? And that's what we're doing right now. I mean, and that's gearing up to knowing that we have one of the highest holidays in the gay community, Folsom Street Fair, this weekend. We've been doing a series of events that's going to carry us through not only Folsom, but Castro Street Fair the next week. So between those two weeks alone, we are planning to deliver around 2,500 doses.
Yeah, that's really
Plus.
great. I think it's been really transformative to have you as a leader helping translate back to us as PH leadership that we need to change how we're doing things and meet community where they are. So I think it really has permanently changed how we think about our work in community with community, and it's been really important. Director Pappas, I know that there are questions that you have for us.
I want to thank you both for both the comprehensive as well as just Oscar, the sensitivity that you've brought to your work as well. We did ask our faith leaders to submit questions in advance, and they have. And I did want to reiterate that in addition to the recording link, we will include the slide deck, because we've had a couple of people in the chat ask about that, and that will go out to our 5,600 e-subscribers by day's end today. Let's delve into the questions. The first is from the Most Reverend Salvatore Corleone, Archbishop of the Archdiocese of San Francisco. The Archbishop asks, since the shelter-in-place order took a heavy toll on the educational and social advancement of children, especially those from economically disadvantaged backgrounds, what advice would you give to faith communities on what we can do to help children regain and grow in their social, emotional, and intellectual health?
I think this is such an important question, and a recognition that the pandemic was so hard on children, and objectively measures of children's mental health and well-being have gone backwards, as well as their educational attainment in many cases. So the role that faith communities play in providing a space where children are loved and valued and supported is incredibly important. The other concrete thing that I would ask as faith leaders is to really reinforce seeking out help, additional help, mental health help for children and families as they need it. And it is an important thing to support that as a normal thing to do, to be able to help children if they're having a difficult time, as so many are.
Thank you. St. John's United Church of Christ is right across from Laguna Honda Hospital. The president of that community, Mary Liz DeJong, asks two questions related to this. What is the status of Laguna Honda Hospital? Closure or reduction in services it has provided for many years would negatively impact BIPOC and other vulnerable populations. And the secondary impact of its closure would impact the quality of life of San Franciscans. Then she goes on to ask, what is the status of mental health care in San Francisco? Although most of the recent attention is on COVID and Mpox, care of those mental health needs remains a significant issue, and not just for the indigent on the streets. What mental health services are available at this time for those with emergency, short-term or long-term needs? So Laguna Honda, mental health.
Such an important question. So Laguna Honda is a critical backbone institution in San Francisco, and it is there's so much work that's happening now. So many of my colleagues are there, really getting ready for recertification and for actually regaining the ability to get funding from the federal government. So right now there's no additional movement of patients. There's that plan is on hold until later this fall. but a lot of work is happening. And so there's so much attention and resource being placed by the department and the city to make sure that Laguna Honda remains the vital resource that it is for people throughout San Francisco. The mental health question is so important, and there are so many providers that are recognizing this. It's not always easy to get mental health care when people want it or need it. And so for, emergency care, there is always, calling if there's an emergency. I think 911, it's a really important, appropriate use of that to be able to get the right mental health services to people. And there are now teams that the mayor has supported, and the department is helping staff that are putting mental health professionals out to those calls. So it's not just law enforcement that goes out when there's a need, that there are people who are trained to respond and to provide essential medical mental health care, and to be able to link people to ongoing care as well. But we know that we can always continue to do better as a city. It is a major focus, again, of our health department and of the mayor to really think about how we help people who are in crisis visibly on the streets, but also encouraging and supporting our health systems to be able to do all of their work as well for people who are engaged already.
His Eminence Metropolitan Yerasimos of the Greek Orthodox Metropolis of San Francisco asks, the Director General of the World Health Organization recently stated the end of the pandemic is in sight, yet all indications are that COVID cases will surge during the winter months. How is San Francisco preparing to deal with such a surge, and can we be assured that access to treatment will be equitable? What steps can religious community take to help minimize the surge?
There's been a lot of attention not only to the World Health Organization statement, but also President Biden, said in a news interview that the pandemic is over. And in a sense, I understand what he's saying, that we have so many tools now, and now we have bivalent boosters. And that is one thing that I would ask faith leaders to really make sure that it goes out in newsletters, or we take some information from the presentation that will be sent out today that we shared to be able to make sure that people know that they're eligible, and here are ways in which they can get their boosters through their healthcare system or otherwise. I think that that's really important, but cases are not, we still have COVID among us. There are 400 Americans who are dying every day of COVID. And so I think we're going to have to figure out how to come into balance. A big part of this is making sure as many people have those updated boosters as they can, and to follow along. And we will adjust our recommendations and our guidance as needed to keep San Franciscans safe, just as we've had throughout this pandemic.
Hala Hijazi, Commissioner of the San Francisco Human Rights Commission and a member of the SFIC board, notes, as it relates to equity, we found at the onset of the pandemic that those who were the most impacted because of language barriers didn't adhere to protocols or were behind on getting tests and vaccines. Now that we are in a different phase, will language translation services, both online and in print, continue to be available to those communities?
This is a really important truth that we know and we learned. We do have to work and provide translation services. And to the points that Oscar raised so well, we have to meet community where they are in appropriate language with appropriate messengers and collaborators. So absolutely, that is a commitment to continue to make sure that people are getting information they need in the language that's appropriate for them, using the threshold languages San Francisco has established.
Sister Kyoko Kimura of the Brahma Kumaris Meditation Center has two questions, and I'll ask them together. We've started in-person gatherings every Friday evening since June. We have not been asking the participants to wear masks nor sit 6 feet apart lately. With rising cases of Mpox and COVID, should we be more vigilant with precautions? What other precautions do you recommend? Should we go back to 100% online events? And then secondly, we've heard that it would not make any difference in contracting or not contracting whether you've been vaccinated or not. Should we still get additional vaccines even though we know we can become sick with the above viruses when we are exposed to anyone who carries it? How effective are the vaccines for Mpox, and is it compulsory to get them?
Yes. Well, I will say, that for the first part of the question, should people be worried or fearful to be back in person? we no longer have restrictions, on gatherings or on the distance that people must be together. And now our masking guidance really says that people should take into account their own health status, their risk tolerance, everyone in their household and what their health status is, and kind of where we are. And, I just said that we are at a low point relative now in our COVID cases. And so I think it is fine to gather. I think it's important to gather. We've been talking about mental health. We've been talking about the importance of faith communities for building our larger community as a city. So absolutely come together. Be mindful of people who might still want to wear a mask and feel more comfortable, and that's perfectly appropriate to do. I also heard some concern about Mpox. I want to reiterate that Mpox is not a virus that is spread through casual contact, being together in a faith setting or even in people's homes. So that's not something that people have to worry about. The vaccines are not compulsory, but they are effective, and we are working, as Oscar has said, to get them to the communities that most could benefit from them. So again, I think it's really important, the work that's being done by the faith communities and you as leaders to bring people together. And I think there's no reason to stop doing that. The other question I heard was, why get the boosters? Well, these new bivalent boosters, we're very hopeful that they will help prevent transmission a little bit more. But even if you've gotten the older vaccines and are not yet eligible for a bivalent booster because it hasn't been 2 months, they do prevent people from getting very sick, and they keep people from going into the hospital and dying. And so it is incredibly important to continue to reiterate that message. Even if there is some transmission, people are much less sick than they would be if they were not vaccinated and boosted.
Just two more questions. Rabbi Beth Singer and Rabbi Jonathan Singer of Congregation Emmanuel asks, Dr. Phillip, we run a 500+ student Sunday school with kids coming together from all around the Bay Area. We can't figure out if we should require masking for them in our classrooms when we no longer require it for services and other events. Some of our parents feel that their kids need to learn how to be with other kids without masks on, and they are not masking in their schools. We are trying to watch out for the overall safety, both physically and mentally, of all our students.
This is such a difficult balance for people who are caring for children and trying to develop and support children and families. I think now what we are seeing in most school settings, as you pointed out, is that masks are not required. And I think there is a bit of an individual decision on the part of faith leaders for what they want to do for their own individual situation. But as health officer, I would say that it's likely okay to allow masks off because children are with each other without masks in so many other settings. Please do reinforce the fact that children can get vaccines, and they should be getting vaccines. That again protects them against severe illness. And for all the mental health reasons we talked about, it likely is good to think about getting back and allowing children to have that face-to-face contact, to see their friends and peers' faces. And again, there may be some children for their own comfort or their families or the health of people in their household where they continue to wear masks. And I think that's fine as well. We should just be supporting people in the decisions they make. But I think it's no longer necessary to always have a blanket policy that everyone must wear masks. If that changes, if something happens with a surge, as we had a previous question say, we will come back. I will come back and be very clear about what we need to do and why. But now we're in a period where there's much more flexibility allowed and available to us.
The last question is from the very Reverend Dr. Malcolm Clemens Young, the Dean of Grace Cathedral. We're already looking right now, this community of ours, at the Christmas holidays. What do health experts expect around the Christmas holidays? And when should we remove the masks from our choir? Can we move back into closer spaces in the cathedral? We have 100-foot ceilings, but have been distributing people around the whole building rather than in one section of our worship.
I think that it's okay to start moving back together as people feel comfortable. And again, all of us have now learned much more than we wanted to about ventilation and the ways in which we can try and improve that. And I think that remains a good thing to do. This winter, we're not only thinking about the surge, we're thinking about flu season. So I didn't spend a lot of time talking about that, but getting a flu shot is really important as well. Getting whatever the COVID vaccine, if the updated booster is available to you because it's been 2 months since your last one, that's also important. So I think that What we're really hopeful of is that these updated bivalent boosters actually do decrease transmission, and it blunts whatever surge may be coming into the winter. But we don't know. This virus has thrown some zigs and zags at us that we didn't see coming. But I do think we're as well prepared as any city could be. And we continue to update with the advances in public health and science and in the vaccines. So if we can continue to encourage all the people in our circles to get the updated boosters, to get their flu shots, to stay home if they're sick. Usually when I meet with this group, I always say that, and I know people are very aware for their congregations and their communities. People shouldn't be coming to events if they're not feeling well. They should just stay home for that time. I think that's something that we really want to reinforce, and especially kids. Kids should be not in these settings if they are not feeling well. But for the most part, we can keep moving forward. I think we're in a good place as a city, and right now we're in a good place with cases relatively lower than they have been. So I'm feeling very positive about all the winter holidays and the gatherings, and I know people are looking forward to being together.
I know that you both know that our communities of faith are here in the wings to help. We were perhaps more cautious than even the city at portions of the pandemic. I did just want to acknowledge that Oscar raised an issue around stigma of people getting the Mpox vaccine. I had been invited to go tour Lyric in the Castro last weekend by Roma Guy, who is a friend of all of us. And one of the issues came up was young people reticent to get the Mpox because the cameras were focusing on the lines outside trying to get the vaccine. And I raised the fact that I said, I suspect that we have some houses of worship that would gladly, be vaccine centers if that was the case, in order not to discourage people from getting vaccinated. So I would just posit that with you because that made an impression on me, and I want to thank Oscar for raising that issue of stigma, because that was very important.
Yeah, and just really quick, please feel free to contact me if you're interested in, having that pop-up event at one of your parishes, churches. We'll be more than happy to have a conversation about that.
Excellent.
Yeah.
Well, we've covered a lot today, and forgive me for whisking through the questions, but I thought they were all important, and you handled them in a very informative way. I want to thank Dr. Butler as well, and Cynthia Zambukis, and Trey Russell Allen, and Shanika in this case too, for your support here today. We do invite you all to come back on October the 6th at 8:30. That's a Thursday, when we're going to welcome Shireen McSpadden, the Director of Homelessness and Supportive Housing for San Francisco, and she's going to give a state of homelessness in San Francisco, which is, we pick up the paper every day, and we see that that's a key and critical issue in our city. That said, this brings today's program to a close. We thank you for being with us. God bless you and God keep you.